Hi, and welcome to Mom Boss Chronicles. We are your host. I am Jen.
I'm Sue.
And we are empowering and inspiring people through meaningful conversations. So make sure to like and subscribe to listen to great content weekly.
Welcome back to Mom Boss Chronicles, everyone. We are excited here to have some special guests. We have Andrea Cernero and Kelly Dyckman. They are the clinicians and founders for Haven for Healing, a psychotherapy practice that just opened up in Shrewsbury in July. Welcome. Congratulations to you both.
Thank you so much.
Just saying leap of faith. So
yes.
Tell us a little bit about, I guess, what sparked, the inspiration to start your own practice and go out on your own. Because I know it's scary, especially when you're comfortable probably where you were and everything. Sure. So what was your aha moment?
Sure. We'd been working together and we were doing a lot of different things behind the scenes. And it got to a place where different things were coming up for Andrea, different things were coming up for me clinically and also professionally about the want for more, the want for different. So we were really fortunate that in the different places that we worked, we developed skill sets outside of clinical world, more in management world. And it got to a certain point of, if we're doing this for somebody else, we could be doing this for ourselves. So really, for me, right person, right office space, timing the best it could be. And it just made sense to make it maybe faster than we had anticipated.
Yeah, but I think it all happens for a reason.
Did you make the decision quickly, I mean, right?
Yes.
Yes and no. I think the decision...
The decision to eventually do something, but the space, I think, the momentum kind of started to pick up.
Yes.
Which was good.
Like the universe being like, okay, great. Glad you came to this conclusion. Here we go.
Exactly. Right. That's how it was. It was like the process to like, should we do this? What do you think? Like talking about it, kind of like developing ideas. But then once the space presented itself, then everything else kind of moved.
Right.
Like faster than maybe we thought. But it all happened, I think, for a reason.
Right.
Right. And thankfully, we've been able to roll with change and roll with different in a way that makes sense for both of us professionally and personally. Yeah. So the stars aligned on that one.
Yeah.
It did feel like the universe was giving us signals.
Yeah. Totally. And I feel like, too, like that's a good life lesson to be nimble, right?
Yes.
To be ready to pivot.
Yes.
When you're presented with, the right opportunities and stuff like that.
Right.
Especially if the calling is in your heart, right? Like you felt it.
Absolutely.
Oh, yeah.
Yeah. So then you acted on it.
Yes.
That's beautiful.
Totally.
Yeah. It's half the
I
battle.
think it's normal though, like I have to keep telling myself, like there's so much excitement and like adrenaline, but then there's times where you do like the leap of faith, like you kind of question, but it's like, nope, we're here. We're already like, we're doing this.
The train left.
Yeah, definitely.
It's more like, okay, how do we pivot with whatever challenges come up rather than, I think if we were like 1 foot in, 1 foot out and something came up, it would have been different where now, like you said, it's got to figure it out.
Yeah.
Right.
And you can.
Yes. That's just it. I think the irony for both of us is that we work so often teaching clients to really embrace flexibility, embrace ambiguity, so then having to do it ourselves.
Yeah.
Was
You have to walk the walk.
Right? Yes. To really practice what we preach, for sure.
Exactly.
That's so empowering, right? Like as a therapist to be able to be like, no, I went through a challenge. I faced it head on. Like, you can do it too. So that's awesome. Yeah.
Yes.
That's such a common theme for a lot of like the guests that we have on too is, a leap of faith, right? And like personally I did that as well, leaving corporate to sell houses and it is so scary, but gosh, like incredibly rewarding, because it's going to work out and we're so adaptable that we make it happen and we're women and we make it happen. And moms nonetheless.
Right.
Yeah, exactly. So your practice now, you guys are focusing more working with like teens and adults, correct?
Yes.
What are some of like the themes, obviously mental health is such a hot topic. It's a huge situation in our country and beyond. We're exposed to so much all the time, more than we should be. So curious, like what the common themes are perhaps that you're seeing in like teens and then also with adults.
Sure. Absolutely. I think for both of us, we're noticing a tremendous spike in anxiety, not just with teenagers, also with adults, especially in the parenting realm as well.
Yes.
Am I doing the right thing? Am I doing best by my kid? Am I doing best in my marriage? So there's a lot of expectation that really is rooted in anxiety. This idea of being good enough, this idea of being best, and really working with people to create flexible and realistic expectations of themselves while also having compassion. So, and that really is universal no matter what your age is, right?
Yeah.
Being able to really show up for yourself as best you can with what you've got.
Yeah.
One of the analogies I use in session, I will never be an NFL football player. And it's not because I don't want to, although I don't. It's because I physically can't.
Yes.
That I am not the size, I am not the shape, I don't have the physique to really be effective in that position. So to ask myself to be that when that's not a physical capability, I'm setting myself up for more frustration, more disappointment. Whereas if I embrace myself where I am and I create realistic expectations of myself and see where that leads, it can be a totally different outcome.
Yes.
You wouldn't ask a fish to climb a tree. So we consider then what we can ask of you and what does make more sense.
Yeah.
So simple and beautiful.
And it literally goes from, like you said, like not only in the teens, we think a lot, but it's a lot of what I see stems from the parents.
Yeah.
Oh, the pressure.
The pressure they put on themselves, then on their children. And I had a session yesterday, and I had was she 15-year-old, like in tears because of all the pressure that is from her coach, from her parents, and then the internal, like that's the external, but then that creates the internal.
Yes.
So managing like disappointment and other things, you know, instead of like normalizing it to say, yeah, when we take risk or when we do something, like it may not always work out as a positive.
Yes, failure.
Yes.
Yeah.
That's what I see, like a lack of,
Failing forward.
Yes. We're scared to do that.
Yes,
like
totally.
we are as parent. I think a lot of the parents are because of anxiety, comparison, expectation. But that like then trickles down to the children, and then they're not able to.
Yeah.
There's also the trend of difficulty tolerating distress.
Oh my gosh.
We live in a world of instant gratification.
You're right.
We live in a world
where
of
things are
external
uncomfortable.
coping. For sure.
Everybody falls apart. I know what you mean.
Absolutely.
Nobody wants to be uncomfortable.
Right.
Yeah.
And because we don't want to be uncomfortable, we avoid, we self-medicate, we engage in a lot of different behaviors to try to get out of feeling
that
uncomfortable.
way.
You're so right.
What's tricky is that many of those behaviors lead us exactly where we don't want to be. So part of what we work on a lot is supporting people and leaning into the discomfort at a pace that's not so overwhelming, so flooding, where they can tolerate the distress and also learn how to cope with the distress more effectively.
And come through.
Because if skating around it only increases the problem, what are we doing?
And it's hard work. Like,
Yes.
I mean, I've gone to therapy. I currently am in therapy. My son goes to therapy, and I love it. You know, I really am grateful. But like, it's so much work to really sit in your shit.
And be uncomfortable,
literally.
right?
Totally.
I think it's hard to like admit to yourself.
Me and like, just forget about it. No, you have to really head on shit sometimes.
And just sit in that uncomfortable.
Yes.
Sorry, I was just going to say, like, that's interesting because you're such a big supporter. What do you like best about your experience in therapy?
So I think for this season of life, like, whereas like when we were younger and I didn't have children, you would just yap on the phone with your girlfriend for an hour and talk shit and, you know, vent about your boyfriend, husband, whatever, or life. But we don't have that, you know, luxury anymore because we're busy moms. So I think having carved out 1 hour a week to sit and speak to somebody where I'm getting off my chest everything that's,
Swirling
you know,
your
we're
head.
busy and
Yes.
crazy and life is crazy, but also then having like constructive feedback.
Yes. Non-judgmental.
Non-judgmental, constructive feedback, but also tools to help like work through a lot of things. You know, like I'm a deep thinker. I'm like the brain never stops. You know, so having some ways to
Slow it down.
you know,
Sure.
yeah. So yeah, it's been wonderful. I'm highly supportive of therapy for everybody.
I'm thankful to hear your experience has been positive because
totally.
part of what we are navigating all of the time is clients who have had negative experiences.
Yes.
And really wanting to support them and having corrective experiences by supporting them in developing skills. That it's great to talk about what's going on, but we are of no good to you if we're not setting you up to be able to cope and navigate and have different techniques on the outside.
Yep.
That if you're relying on me to unleash every week,
Yeah.
am I really supporting you in the most effective way possible? So really thinking about some of what we're hearing from people that's been beneficial, what's not been beneficial, while also staying true to ourselves about what our skill set is.
Because everybody's personality and approach is different.
Definitely.
But I will say that's something that post-COVID I think we experience more is somebody coming in and already having experience in therapy. Whereas pre-COVID, I think not as many people had
The ability.
like had experience.
Yes.
And then it's also like the maybe misconception of like what is therapy? Like,
so true.
I hear all the time from oh, I didn't think it was going to be like this.
Yeah.
Yes.
What'd you think it was going to be?
It's crazy because I still feel like there's still a weird stigma around therapy. Like, oh, well, you're crazy.
I
you
know.
Or like something, you know, it definitely died down a lot. But I mean,
but why
first
were we
time
so conditioned
I
like
don't,
that?
because I like, oh, you're going to the shrink, you know?
Right?
Like,
You're
so
weak.
Or a punishment.
Yeah,
like, I feel like parents would threaten their
right.
children and say, well, if you don't behave, you're going to go to therapy. Like, as a negative, instead of it being a tool. Like you said, part of your wellness routine.
Yes.
Definitely.
Absolutely.
That stigma piece is interesting too, because in the work that we do, there's a lot of generational unpacking. Messages you got from parents, from grandparents about who you are, how you are, what we do, what we don't do. Just last night I was talking to somebody about the family way of coping is not coping. That you brush it under the rug, you move on with your life. Yeah. So being in a marriage situation where there is more open communication, there's so much discomfort and there's this readiness to be playing defense all of the time.
Yeah.
And have to really remind the pair, you know, you're talking to your spouse and not to your mom.
Yeah.
You're talking to your spouse, not to your sister.
Yeah.
So grounding people in now as opposed to where they've been because of that stigma. That I get it, right?
And
To an
conditioning.
extent, for sure.
Yeah.
There's this idea that you're going against your circle, that it's this conflict with loyalty if I'm telling somebody what's happening with me. But then we have to look on the flip side, right? How are you being loyal to yourself if you're serving everybody else and not you?
Yes.
That if something is uncomfortable, if something doesn't make sense for you, why would we continue to ask that of you?
Yeah.
Right? Doesn't make a whole lot of sense.
Yeah.
So when you pull it apart and you really get to the bottom of it, just because this was the norm in your family, doesn't mean it has to continue.
Yeah,
to
it doesn't have to
for
be
you.
now. I see that a lot. So I actually, one of the pieces that kind of pushed me to make a change was I got certified in perinatal mental health in the spring.
Oh, wow. That's amazing.
Thank you. And I think that piece that you're talking about is so huge and coming up for not only moms, but parents.
Yes.
Is, wait a minute. All this stuff from childhood is now coming to the surface. That was not part of like the planning of pregnancy or even like education from like your OB. Like there's never any talking about that
Mental
part
health.
of it,
No,
of how this is going to shift, how maybe then like the way you're parenting versus the way your parents did or the opinions, all of that now coming to the surface. So talking about trends, that is one.
Yes.
That I think a lot of people don't expect and are like, whoa, what's happening here? Like I'm almost like reparenting myself.
Yes.
And
Yes.
not understanding why. So I feel like that is definitely a big one. We've seen, I think in the past year plus, an uptick in couples coming in, not for traditional couples counseling, but for assistance with co-parenting.
Yes.
Like
yes.
we're on the same page, but we're not, really showing up consistently for our child and really exploring that piece has become huge.
Yes.
Well, I appreciate the people that are stepping up to the plate, though, at least, and seeking help
Yes.
for that, and not just like, again, sweeping it under the rug or pretending that there isn't an issue.
Sure.
So, like, for the co-parenting, is that people that are married?
Yes.
Yeah, okay. So it's not even like it's like
Sometimes.
Yeah, or not.
Right.
I mean, it
I'm
doesn't
sure
have to
there's
always
divorce,
be.
too. Like that to me is where my brain went originally. But I love to hear though the married couple too. Okay, we're not seeing eye to eye on our parenting approach.
How can therapy help us?
Right.
Yeah, connect on that.
Yeah, that's
Can be
wonderful.
with married couples, can be blended families
Yeah.
also. So if we're talking about a
can
parent and a
imagine
step-parent, if
That's
we're talking
amazing.
about parents who have decided they're not going to be married, they're separating. So how do we do this in the best way possible for our kids?
Yeah.
So it depends. There's a combination of different dynamics to consider in that way too.
Separated but living together is
Right.
something that's more common
Right.
and financially like makes sense for people, but it's confusing.
Yeah. Oh, right. For a little kid or a child of any age, really.
Right.
Heck
It's confusing for parents.
Yes.
It's confusing for adults. Has to be confusing
Totally.
for kids too.
Yeah.
Absolutely. And like I think like regardless of any sort of like throwing in a wrench in anyone's spokes, like we all need help. Especially parenting, and it's that's why I feel like when I say it takes a village and having professional help even just to like help navigate how to be a good parent and show up the right way and taking care of what goes on over here. It's funny, like as I'm more into parenting, I think about the things my parents, how they were as parents.
But they're
It's inevitable.
How they reacted. Yeah.
Right.
Yes. I'm like,
Right.
But a lot of eyebrow raising going on over here. But it's very interesting how it does kind of bring up memories or thoughts about like my own upbringing. And
Yes.
Yeah.
Yes.
And then it's like, wait a minute. Let me make sure I'm not repeating, or these were the things I appreciated that my parents did. So let me make sure that I'm doing that too. But going to therapy really helps like bring that
unpack
stuff
it.
up.
100%.
I feel like life is hard, right? And anyway, like it's hard to like not be wounded in life. Like you just go through life and you have challenges, whether it's work or relationships. So I think therapy honestly benefits everyone, like no matter where you are in life. Like, would you agree? Like,
absolutely.
Oh yeah, those wounds. Like I feel a lot of times you're aware of some of your wounds, but some you're not until they get poked.
Yes.
And you're like, whoa, what
why
was
am
that?
I reacting like this?
And I see, another like common sort of like trend that I'm seeing is parents coming in and their children are going through something that then triggers something within them, an old wound.
Yeah.
Right.
So whether that's, not, pursuing what they want to, or like kind of being deterred, or social dynamics being left out,
Right.
and what that creates for like the reaction it creates from a parent. Not only presently, like, am I going to be left out of all the parenting things, but also like, oh, I remember feeling that way as a child.
Yeah.
And it just brings up things. There's so many layers.
Oh my gosh.
For sure. For sure. There's a modality that I utilize called internal family systems. So this idea that we're all made up of different parts. And I work a lot with predominantly adults on being able to identify different parts. So that part that felt left out, that's so ridden with anxiety and fear of what that's going to look like and how that's going to impact, and really working with the people to understand when these parts are activated, how they present, what that looks like for the person, and how the person can really support that part in assimilating into their system in a way that makes more sense. So could talk about IFS forever.
It's such a great modality.
Yes. And really, really the emphasis is the trauma of the individual's experiences. So any wound someone has, it's not our place to decide what someone's trauma is, but it's certainly our responsibility to hold space for that and to be able to support that person in working through it and assimilating what happened into their world in a way where it's not dominating. So supporting people and understanding that what happened doesn't have to define them. They get to define them.
Yeah. And it could always change. Like, the next day is a new day.
Right.
Exactly.
Oh, so much. I feel like we could go on. So now you both are mothers. Your children are
5 and 3.
and yours are
4 and 1.
Yeah, so you have littles, and which is so exciting because these are such the like fun ages and like little mushy babies. So I mean, in terms of like setting up the practice for yourselves, and what do you see like for the future? I mean, like this I think allows you to be more present too, probably for your children as they're growing older and getting more involved in sports and activities.
Yeah, I mean, we definitely want to be a support to the community, and not only just seeing clients in the traditional setting of individual, couples, group, but also like different workshops. And so people who may not like feel they are ready to engage in like
weekly therapy,
bi-weekly, but like want to explore something. So putting on more of like the psychoeducational
I love that.
type workshops
like
and
taste.
presentation.
Exactly. Like I'll have a taste.
Or on a specific topic. So like we were actually just talking last week about holidays brings up so much.
Oh, I could imagine.
So like boundary setting, communication on like a specific, so it's more specific, but can be generalized. So doing that is something that we both really were passionate about in addition to. And then we both have been in a supervisory role, so training pre-licensed clinicians.
Oh, I love that.
Yes.
Okay.
So we love that piece. So being able to bring on, somebody who's newly licensed and kind of guide them through, mentor and guide them through.
Yeah, paying it forward in a sense, right?
Absolutely.
That's a beautiful thing.
Yes.
And
And really meeting the needs of what we're seeing. So when people come in and there's a trend that's happening with moms or with parents or with young adults, kind of working behind the scenes of, it looks like this could be something that could meet that.
Yeah.
Because that's meeting a need on an individual level, and we're kind of chatting about what we're seeing. But like if it's in more of that kind of workshop, it could touch so many more. And then maybe somebody says, oh, wait a minute, that brought up a lot for me. I think I then want to work individually.
Steps, right? Like you were saying that there unfortunately still such a stigma. Like that's like the first step.
It's like, I know.
It is.
Step one, just get to know a little bit more about it. Step two, then like keep immersing yourself. Yeah.
Exactly.
Definitely.
And just collaborating with other providers.
That's what I love to hear. Like you really said the key words, like giving back, like being a part of the community and giving back to the community and like being present, because when a community thrives, we all thrive.
Yeah,
you know?
exactly.
And it
raising the vibration.
Yes, exactly.
Yeah.
And working, I think the biggest thing was like, could we have done this? Like, could Kelly have opened her own practice and I opened my own? Sure. But like, when we work together,
cool.
it's just,
Very.
I feel like that's not something that, I don't know, a lot of people have that shared mindset. They're like, it's very competitive.
Yeah.
And
It doesn't have to be.
And it doesn't have
it
to
shouldn't be. Right.
And that's what's really interesting too, is that being able to have a partner in this process, not only does it help logistically with different things, but it's also the person who you can bounce ideas off of and go back and forth with. And I do feel like in mental health, the collaboration piece is something that we know is missing regularly. People don't coordinate with care teams. People don't necessarily connect in the way that could be beneficial for clients. So to serve as a bridge to do that for our individual clients, but also the possibility of clients coming together, workshop-wise, group-wise, to
There's more you
create
could do
their
together.
own network.
Oh, 100%.
There's a lot of potential there too. So it's, again, we're no good if we don't practice what we preach,
Yeah.
right?
Yeah.
So holding
Exactly.
ourselves accountable to really doing the work in the most effective way possible in service of the individuals and the community, and the potential, to expand from there, if it makes sense.
Yeah.
Sure.
Is there, I don't know this personally or anything, but just curious, like, let's say you guys have clients like teenagers or something, and they're, maybe seeing their guidance counselor at school. Like, would you
Absolutely.
connect with them? Okay.
I
To
feel
have,
like
a
that
plan
is
in place or something.
sure.
Yeah,
Okay.
that's the way we both are aligned
Yeah.
in our practice.
That's
Is that who are you utilizing as supports? Like, we're asking that on the initial intake session.
Yes.
And you have to get signed releases. You have to have their consent to be able to collaborate. And I am surprised that people are like, "Oh, you're gonna call my psychiatrist?" I'm like, yes. Like,
should.
Sure, or primary care doctor,
Yeah,
or
we-
oncologist, or
whoever
it is.
is, yes, part of that. I have a mom who's on her journey of exploring some infertility and like collaborating with, even though that's not maybe seeming like it's in the mental health scope, but it's a huge part of what's going on.
Of course it is. I can't even imagine what going through that,
Right.
and
But I don't think it's practiced by all.
yes, no.
And I feel like you see the bigger picture then when you're able to talk to
So much so.
Yes, you get so much more information besides just what you're saying. I mean, think about it. I'm seeing you for 60 minutes a week or every other week.
Yeah.
I'm missing so much that if I were to talk to, whoever else is part of your support team or,
kind of understand
and
the
perception
situation.
is different, right? Like, so what your client may perceive
Their
may be
vantage point.
different when
Yes.
you speak to the provider,
Absolutely. Which happens all the time, especially when we're talking about medical professionals.
Yeah.
So I work with a lot of people who are navigating chronic health concerns, acute health concerns. So what someone hears during an appointment may be very different than when we're processing it together.
Yeah.
And also, too, supporting doctors and understanding, hey, these are considerations you might want to have.
Right.
when speaking
And the
to
other
this
way
person.
around. Like,
Yeah.
Family members also. So if, whenever I work with teenagers, I have contact with parents or guardians in some
That's awesome.
capacity.
Yeah.
Why? Because the teenager obviously is the focal point, and there are eyes and ears around that person that are beneficial also, because I'm only with you 60 minutes a week.
Yeah.
So because of that, not having that collateral contact, you're missing huge chunks and also really valuable chunks.
Yeah.
Oh, yeah.
Because what that person sees, their perspective's their reality.
Yeah.
So what somebody else sees, if I don't have that information, that's a whole wealth of knowledge
That I'm missing.
that is missing and
From
could
their
be
treatment,
Really beneficial. Right.
I think the biggest thing for teens is that they understand it's confidential.
Right.
So although I may be calling your school counselor, you're talking to mom or dad or whoever, that doesn't mean I'm sharing everything you said.
Yes.
It's a lot of listening.
Yeah.
And I think once we explain that to a teen client, they're like, "Oh, okay." And this could really help. You're getting very frustrated with mom or dad. Like, if we could provide them some understanding and give them some tool. Oh yeah. Okay, you could call.
Yeah.
Like, it totally disarms them to say, "I'm not telling everything that
Yeah, I remember
you're sharing."
as a teenager, the last person I wanted to talk to was my parents. And I would have been so much happier to have had somebody else that I can share everything with, and I didn't. And how amazing that teen does have you.
Definitely.
Yeah.
Which is
Gosh, there's so much you keep in.
For sure. And that's part of what we do also, differentiating between pathological and normal developmental. So really supporting people and understanding that, yes, it is appropriate for your 15-year-old to not want to spend every minute with you.
Yes,
100%.
they're feeling lots of different
or to
things.
take a little bit of risk taking and
find out
where,
who they are.
but that creates anxiety, as we said
100%.
before. Is this normal or is it not?
Right.
Like, where should I get concerned?
Where's the line?
Because what I read online says, blah, 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 and I get
know.
on my thought spiral. But
Exactly.
having somebody to really help guide that conversation, it alleviates a lot of their anxiety.
And vice versa. Well, I don't want my parents to know these elements. Like, well, let's play out how this is going to go. And really sitting with that person, this is
Walking them
exactly
through
what
it.
I'm going to say.
Yeah.
That's it.
Yeah.
And it's
Going
astonishing,
to the worst
right?
case scenario. Okay,
Exactly.
worst case, your mom says this.
Well, and that's the anxiety piece, right?
Yeah.
When we don't know, anxiety spikes. And that's where we see some of the complications come into play. So we both are very aligned with the transparency piece.
I love that.
I don't sugarcoat, no matter who I'm working with, mostly because it does them a disservice. So if I treat someone with kid gloves, all I'm doing is letting them know that I don't think they can handle it.
Yeah.
And that's not a precedent I want to set
Yeah.
for that person or for anybody else in their lives also.
So true. Yeah.
It's crazy how many people just like project. Like they project the outcome.
I know.
Is
They just
always on the
assume
negative.
it. Yeah.
Well, because I think, right, it's probably easier just to like default to negative.
Sure.
Yeah.
And you have to put more work into like, no, the outcome, like just.
It could be different,
One,
yeah.
let's see how it plays out.
Yeah.
Yeah.
Be open to that.
Right.
Yeah.
Well, and that's where we see the conditioning come into play, the life experience come into play, that many people do operate under the assumption that good things won't happen.
Yeah.
So then our
yeah.
responsibility is play that out.
Yeah.
So if you are anticipating that nothing good will ever happen to you, right?
What do you
have
think?
blinders on that are totally
You're missing. I would say, and I don't think people mean to react that way, but even sharing that I was going off on my own. What do you mean? Like, but you do well there. Like, why would you? But
I know.
like a lot of their own anxiety
Put on you. Yeah.
put on me of like, okay,
That's a
well, this
huge
could also
thing.
be really great,
Yeah,
right?
I know,
Like,
right.
but like, let's say in our comfort zone
Yes,
is like,
yes.
whoa, you're stepping outside of your comfort zone. Why? Why
I know.
would you do that?
Because we're all just kind
Imagine
of
if we
conditioned
all
and comfortable.
listened
Yeah.
like that, like, to that side. I would still be
In corporate,
a slave
yeah.
in
Yeah.
corporate.
I mean, one of my favorite mottos is life begins out of your comfort zone.
Yes.
Oh my God, yes.
And I taught myself that as a young adult because I went into real estate sales, which was so hard.
Sure.
And I had to keep reminding myself, like, it's going to get better once I get uncomfortable with doing these things. And it did.
Doesn't it get actually like really? I enjoy challenges now.
Yeah.
Like I enjoy like a change.
But it was a hurdle.
Of course.
The first challenge.
Yeah,
was like, I
I'm
can
a
never
Taurus
get through this.
as well, and I'm not well with change. So like,
Well, and it depends who's there to support you
Yes.
through that
Yes.
because, I think that if somebody was saying, no,
Don't go. Yeah.
don't go. The real estate market's terrible.
Yes.
Don't go. You may have second guessed.
Yes.
Even though you had such like a strong foundation to say it's okay.
To be
It's going to be, there's going to be in anything ups and downs.
Failure,
right?
for sure.
Plus, we suss it out. There's a difference between being uncomfortable, being in pain, and being unsafe.
Yes.
And that's a spectrum
Oh,
that
that
we
is
talk about a
so
lot,
true.
right? So being able to really
Yes.
support someone in understanding the difference between discomfort of doing something new
Yes.
versus discomfort of being unsafe
Which
versus
is, oh my
discomfort
God,
of an
huge
experience
difference.
of an emotion.
Yes,
a
you're
lot
right.
of different things
That's a
happening
huge
there.
difference. Unsafe, uncomfortable. Yes.
Yes.
Yeah.
Yeah. And it kind of then shows like, okay, I can be uncomfortable.
Yes.
Although I don't like it.
It's not going to be detrimental to me to be uncomfortable.
Yes.
And
Like,
it is.
yeah.
We play that out also.
Yes.
Right? Really differentiating between uncomfortable emergency and uncomfortable, this is new, this is different.
Yeah.
Yes.
And I will say we do a lot of COPA head planning for identifying those things in clients like, okay, what's upcoming that could be stressful? And then when you do a COPA head plan and walk it out, the next time they come back, okay.
I love that, and that's
I was
something
able to
I
use my
need.
skills.
Yeah, because we were saying this too about how like sometimes like I can't lie on the fly. So like maybe someone will ask me something and like instead of being like let me think about it or let me get back to you, or I'm like yeah sure, and then I like be like
Why'd I agree to that?
Agree to that,
Yeah.
or why did I like
Yeah.
respond so quickly to something like I should have thought it through?
Yes.
So
Yeah.
I was like sitting down and thinking about like canned responses in the future.
Sure.
Instead
Yes.
of like the knee jerk like
Yeah.
Well, and
Right.
boundaries,
Yeah.
right? We talk a
gosh,
huge,
huge,
lot
constant.
about boundaries with our clients because it's almost like you feel like you have to say yes.
Be
And
accessible. Yeah.
especially, I think, in your line of
Yes.
work.
yeah.
It's like, oh, well, I'm just supposed to be on 24/7.
Yeah.
But it's okay to say no to things.
Yes.
Yes, which
Yeah.
is a stereotype we can all acknowledge is really going against what we're taught as females.
Oh my
Yes.
gosh. Yeah.
Oh,
There's this
yes.
idea that we say yes. There is this idea that we should be accessible. There is
Do
this
it
idea
all.
that
Play
we
nice.
should be able to do it
Yeah.
all.
Nice and
Yeah.
Right. So it's interesting. Earlier today, I was talking with somebody about the fact that she can feel angry. She's allowed to feel angry. And in fact, not allowing herself to feel anger results in her not acknowledging things she's picking up on in the world
Yep.
that she's perceiving as unjust or unfair.
Yeah.
So really, if she never
Yeah.
lets herself be angry, she's totally contradicting her moral code, right? Because if she's neglecting signals that her moral code is being violated in some way, even if that's her perception,
Yeah.
you're just compromising your own integrity there. So what are we doing? So it's this interesting thing, right? I'm hardwired to have to say yes, but then when I do, the emotional repercussions, I'm the only one who's dealing with that.
I know.
So exactly.
Yep.
Right.
But I think I saw, I don't know, obviously I didn't do further research, but like that because women suppress their feelings or like what they truly want or to say or whatever, like we're more prone to like autoimmune diseases because like we suppress
we keep it internal.
Suppression. I mean, that's
and
another
then
thing
our
that
body's responding.
Yeah, your body keeps score, right?
Yeah.
Right.
Yeah.
Which is why I think therapy is so great. Like you have to get it out. Is there a great age to start therapy? And I know this is a silly question, but what would you recommend to our audience? Should all children be in therapy? I don't know. Should all young adults? Should all adults be in therapy? Like, what is?
I think we like to look at like your daily functioning, how things are showing up and impacting. I think a lot of people wait to maybe I don't want to say late, but like they wait till there's a crisis
Something's falling
to
apart.
then engage.
Yes.
And it's hard as a clinician to then, right? If you're in crisis, the way you're showing up to the office is very different. And we have to stabilize before we can really do all that other work we were talking about. And a lot of people then, if they're coming in crisis, like, well, I'm not feeling better. Like, this isn't working. That's when a lot of people don't feel it's effective. So I like to say incorporating it into wellness. And you use the phrase seasons of life. Like, a lot of clients pop in and out. Like, they come, work through something and like maybe they go on like more of a monthly maintenance every 6 weeks. And then if something else is going on, they're more consistent and active.
Yeah.
But it's always something that is like part of their wellness and their routine.
Right.
That's awesome.
I think part of it too is what someone's expecting to get from therapy. So that also is very age dependent. That if I'm working with a 6-year-old, successful therapy is going to be really different with a 6-year-old than it would be with a 55-year-old.
Yep.
So there's also considerations of context. There's considerations of what's happening developmentally. So it also depends on what somebody's goals are. So that's interesting too in the context of parents versus teens.
Oh my gosh, I can imagine.
What the parents decide they want
What their goal
versus
is.
what the teenager wants. So being able to suss that out also, and also checking people with what realistic expectations are. I'm not going to tell you what to do. I'll work with you to figure out what your options are, but then the ball's in your court as to what you do from there. So it's a lot of supporting people and understanding what therapy actually is versus what media has told them it is, what other experiences have suggested that it is. So that's where age, it varies.
It's by so individual.
Right. I think, too, it's interesting. In our graduate school programs, once upon a time, if you were going to be in this field, you had to have therapy experience. They took that mandate away, which
really?
I love
yes,
that.
I have mixed feelings about, because I think if you can't appreciate what it's like to be on the other side of the desk, not that it makes you ineffective, because I don't mean that. But there is an appreciation you have for your clients when you've been on the other side.
And I feel like that with real estate too. Like, yes, it's transactional a lot of times in my brain. I'm like, I go through this all, but then you have to remember there's an emotional side to it. You know, so yes, having that experience and thought process of
physically
what
moving
it's like
and selling
to be
a house.
on the other side.
Oh my God.
Right.
Moving is like one of the top stresses.
That's first. And then moving is second. Not exaggerating.
And you're having
is third.
Yes.
Yeah.
So it is. It probably elicits a lot of emotion. And I know that I have a friend who's a realtor, and she just says recently it's just been a lot of, somebody losing a house. It's so just up and down that there's such an emotional response from her clients that she's not
We're therapists.
sure. That's
Truly.
Yeah.
Sometimes I gotta walk around with a white light. Bounce that off. So in terms of like operations for your new office, how's getting everything off the ground? I mean, and essentially for people like to book through you, you're all set for like insurance and everything.
Yes, so we're considered an out-of-network provider, meaning we don't accept. However, we've discovered a third-party platform, and I would say so many of our clients, definitely more than half, have out-of-network benefits that they don't maybe know about or realize, and they're able to use it, and they're paying what they would pay through insurance.
Amazing.
So I tell everyone, let me take it and run it to see before they just hear we're not, covered. I also think a lot of people who do take insurance are maybe on a wait. It's different. We're able to get in maybe a lot faster.
We're also realistic too that financial considerations obviously are something for us to be aware of.
I know it's a barrier. Yeah,
It can be. And we do the best that we can to support people in navigating what that looks like, being flexible with the sliding scale, if that makes sense for someone, because we don't want finances to be the barrier to care if it feels like either of us is
Exactly.
best for you.
Yeah.
So we really try to be transparent
I really
and
appreciate
supportive.
that because, you know,
100%. I mean, I would say
a lot of times money is a big stressor for people, and if they don't
Exactly.
have it, like, you know, or right.
And I'm a tried and true social worker. Andrea's a mental health counselor. That you have to be aware of where people are, because if you're not, and if that's a barrier, and we're not looking at the barrier, there are considerations you have to have, especially now as business owners. Are we creating our own issue in terms of access to care, in terms of supportive care?
Yeah.
Right.
So I would say we want to have the conversation. We don't want to deter somebody not to call because we don't take insurance, because we will work with them. I would say, and if our sliding option, if they do not have any out of network coverage, we're getting them connected with somebody who does. That's awesome. Which is also helpful, because I think you get overwhelmed.
Yeah.
Like, how do I pick somebody? I don't know. Do I look at their picture? I don't know their modalities, their training.
It's so absolutely true. I mean, I've gone through many different therapists. Like, you know, my parents divorced when I was in high school, so my mom, you know, amazing relationship with that woman. And after my mom passed away, I went to someone, wasn't a good fit, you know, and but it's right. How do you know? You don't know until you kind of start going.
Exactly.
And I found someone who was the right fit, and it was
Exactly.
great, you know. So,
right. And that's
that
the most
part,
important, right? To find the best fit. And that's why also there's the workshop piece, there's the group piece, that we want to make ourselves accessible.
to feel the connection.
Yes. And
love
to make
that.
ourselves available too in a way that is realistic and that makes sense. Definitely. So we both are accepting new clients. So, you know, feel free to call us, feel free to look at our social media, our website, so that, you know, we're ready to take you on if you're motivated to be on board. And if you're not motivated, talk to us and we can help you getting there.
And will you post about your workshops and everything online?
Absolutely.
Yes,
So
on our
Instagram?
which is
on
our
your
website.
The name of your business as
Yep,
well?
Even for Healing NJ.
Awesome.
This is our Instagram.
Because I'm definitely going to check that out. I want to.
Please.
Yeah. That's awesome.
Yes,
And you guys are
definitely.
located in Shrewsbury.
We are.
Yes.
Yeah.
Yep.
So I think that actually that's probably I don't want to say most challenging, but like getting ourselves out there.
Yeah.
Because I feel like for your business too, it's a lot of referral.
Oh, yes.
Yeah.
So I think
And there's
that
a lot of noise, right? Like
Yes.
a lot of noise of this therapist or these realtors, but it's
Yes.
finding the right for your needs. So.
Exactly.
It's funny for both of us because worlds collide, right? In the world, I'm learning, I'm not being a Monmouth County native, that Monmouth County is so small. So we've worked in different places. Hey, are you the Kelly that was here 5 years ago? Yeah, that was me.
Oh my
Nice,
God.
nice to talk to you. Yeah. Which is also reassuring that we're really fortunate
Building roots.
that we've planted ourselves in this profession, in this community, and we're really fortunate to spread our wings differently right now, which is a nice thing.
I think it's so beautiful, like what you guys are doing, what you're doing for the community, Monmouth County. Even if you're listening anywhere in the world, hopefully they've inspired you to seek therapy. I feel like anybody could benefit it anytime in their life. There's so much. I'm like, I want to unpack right now.
Yes. We could sit here for hours. Where's the wine?
I'll make an appointment tomorrow. Yeah, but and even thinking back on my childhood and my trauma wounds, I'm like, wow, you're right. Like when you were saying that, I'm like,
how they show up now. Yeah.
oh, gosh, didn't even think about that.
Yes.
Yep.
Thank you for all that.
Yeah. Thank you, ladies, for coming on today.
Thanks
We
for
wish you
having
the
us.
best
Thank you
in
for
this
having us.
practice.
Yeah.
Thank you.
And we'll have to have you on next year as like a recap to
Love
see
it.
how the first year goes.
Yeah.
And how you guys have grown. That would be amazing.
Definitely. Appreciate it.
Great. Thank you so much.
Thank
Thank
you.
you all for listening. Make sure to like and subscribe for more great content.